Okay, so this is the Canalith repositioning maneuver, or Epley, for treatment of BPPV, posterior or anterior canalithiasis. So George is my patient, and I'm going to start him off in a 45-degree rotation to the right, 30-degree extension to pre-position him. After a few seconds, I'm going to tell him to sit or lay back quickly and keep his eyes on my nose. It's important that the eyes stay on the nose so they're not moving around. It's a lot easier for trying to look at nystagmus in the eyes. Okay, 3, 2, 1. Okay, he's going to keep his eyes on my nose, and you're looking for an upbeating torsional nystagmus for posterior canal and downbeating torsional nystagmus for anterior canal. If the patient has significant amount of symptoms, then you wait for it to dissipate completely and then add 30 seconds just to make sure everything has calmed down in the system, and then we move on to the next position. So the next position is turning to the left, making sure that when I move his head, I don't lift it up, because if I lift it up past horizontal, then we mess with the whole maneuver and we have to start over. So we're going to turn to the left in 3, 2, 1. Make sure you keep his eyes on your nose so you can look at the beating of the eyes. If it's difficult to notice if there's a beating or a spinning, a torsion of the eyes, one trick is to look at the blood vessels in the sclera, the white part of the eyes. If you see that turning, then you know there's a torsion. It's a little easier sometimes. Okay, so wait for his symptoms to dissipate, then add 30 seconds. The next one, I'll ask the patient to lie on the left side. And so go ahead and bend your right knee. Okay, reach over your body with your right arm, and gonna turn in 3, 2, 1, turn. Okay, so I'm going to point his nose down towards the corner, not towards the ground or towards the wall, but where the wall and ground meet at a 45-degree angle. Same thing, symptoms plus 30 seconds. It's more difficult to see his eyes unless I'm get myself really low, so it would be helpful to have Frenzel goggles if that's available. Okay, after that, I'm going to ask him to sit up, making sure to keep the nose down at the left armpit at all times and not lifting the head up. Okay, 3, 2, 1, sit up. Okay, keep that head down towards the left armpit. Same thing, symptoms plus 30 seconds. And then once that's finished, you can ask him to sit up. And make sure you retest for the Dix-Hall Pike afterwards to see if his nystagmus and dizziness symptoms are gone.